Okay, well, I hope this is recording the right way. This will be fun. All right, let's see what we're gonna do here. I've got a video for you guys. We're gonna do slideshow, beginning. What the? Oops. Hmm. Okay, we're gonna roll it like this. Okay, here we go. So the endocrine system. Oh, perfect. Okay, let's get started with the endocrine system. This system is as unique as a fingerprint. And the best way to identify and understand the endocrine system is by identifying the location of each gland. That's going to be your step one. Um, if you have to draw the glands, if you need to look at something visual, I've got something in this PowerPoint for you. Note taking, remember what I was telling you guys about note taking, but let's get started. So the endocrine system, this system regulates our body function and helps communicate with the body systems. How does it do that? It is through hormones. Okay. Well, let's go through what we're going to talk about here. We're going to recognize functions of the endocrine system. Please disregard the chapter numbers here. Okay. We're going to talk about the structure, function, um, interventions, both therapeutic and surgical, and we're going to make sure we understand the terms in this chapter correctly. Some medical terminology here. Endo means inside, crine means secretes. If you see something with the endocrine system, please know that is a nice way to remember it. But let's talk about it. So the organs of the endocrine system. The principal endocrine glands and their hormones. Let's talk about it. Now, the hypothalamus, that produces a hormone, okay? And what it does is release and inhibit other hormones. It's located in the anterior lobe of the pituitary gland, so located in the brain area. And it stimulates or inhibits the secretion of specific hormones. We're going to get to that. Okay. Now, what hormones does it work with? Well, we've got a few here. Growth hormone, right? TSH, thyroid stimulating hormone. Okay. ACTH, adrenocorticotropic hormone, comes from the target tissue there is the adrenal cortex. The FSH, so women that are ovulating, trying to get pregnant, that is a key component of the reproductive system. Want to keep that in mind. So the ovaries and the seminiferous tubules in males, that is the target organ of those hormones. Okay. And again, hormones are the chemical messengers. If there is this dysfunction with the endocrine system, it is because it is secreting too much and or too little. Okay. And we want to know what the target organ is. And we're going to get to that. Okay. I'm still talking about the hypothalamus here. Okay. The posterior lobe of the pituitary gland now, we store ADH and oxytocin there. And the target tissue for those are uterus, mammary glands, and kidneys. Basically, that's going to help us increase water reabsorption. And what it does is kind of decreases the water lost in urine. And if it works on the uterus, well, that's going to stimulate contractions or milk. Lots of fun stuff there. When we think of the thyroid gland, let's get to a picture. When we think of the thyroid gland, we want to say, hey, what hormone comes out of the thyroid gland? Well, thyroxine, and then thyroxine, calcitonin. So bones get targeted with calcitonin and body cells with T3 and T4. Okay. What does it do? Those are going to increase metabolic rate, which is essential for normal growth and development. Calcitonin, remember that affects the bone, decreases blood calcium, by basically blocking bone breakdown and release of calcium. It's antagonistic to PTH, or parathyroid hormone. Let's keep going. What about on the kidneys, the adrenal gland? What's happening with those? Mineralocorticoids. Think mineralocorticoids, glucocorticoids, like cortisol, that stress hormone, right? Androgen, estrogen. Women that have too much androgen, we have male-like appearances, right? Facial hair, body hair, all kinds of hair everywhere, look like a man. Okay. Estrogen, same thing. That can feminize males. All right. So cortisol will increase glucose levels and basically inhibits inflammation and immune response. Hence why when our stress is really high, our blood sugar levels can go up. Okay, and we're gonna have problems. We're gonna feel sick. We're not gonna feel good. Okay. Let's see here. What about one of my favorite ones to talk about with the adrenal gland? Epinephrine, norepinephrine. Okay, those are hormones from the adrenal gland as well. The target tissues on that: heart, blood vessels, liver, and adipose tissue. Helps us cope with stress. That will spike our heart rate up and spike the blood pressure, increase blood flow to the skeletal muscle so we can do the fight or flight response, sympathetic hormone system. Okay. Let's see. What else with that? Oh, and it's going to increase blood glucose. You can give epinephrine in an allergic reaction response like anaphylaxis. Okay. What about this next organ, the pancreas? I want you guys to remember something about the pancreas. Inside the pancreas, you're going to find little islands or islets called the islets of Langerhans. Hormones found there: glucagon, insulin. Glucagon target tissue is the liver. Insulin pretty much goes everywhere, but we got a lot of it in the liver, skeletal muscle, adipose tissue. Glucagon then increases the breakdown of glycogen to increase blood sugar levels. Certain medicines work on the liver to decrease glycogenesis. Okay. Now, insulin, that brings down the blood glucose level. Okay. Testosterone, right, from the testes. That's male maturation. Okay. And the maintenance of male reproductive organs. And of course, secondary sex characteristics of males. The pineal gland secretes melatonin, helps go sleep, sleep, night, night. Okay. Target tissues, hypothalamus lets us know, hey, it's getting dark outside. That's the sensory area there. Your eyes sense the darkness. Goes to the pineal gland, secretes the melatonin, regulates our sleep-wake cycle. The thymus, not pictured in this picture here, but it's centrally located right in front of your corazon, your heart. Okay. That is fully mature by the time that we're 12 years old. It actually shrinks as we age, and it helps us with our immune response. Okay. Now, talking about the kidneys here, right below those adrenal glands, we're going to talk about ANP, which is atrial natriuretic peptide, and B natriuretic peptide, BNP. These work on the kidneys and increases sodium excretion, causing diuresis. Why is that important? How to know how diuretics work. What's their mechanism of action? And inhibits release of renin. Remember the RAS mechanism, the renin, the RAS mechanism. Well, I don't want to go into that. I don't want to confuse anybody. Now, exocrine gland versus endocrine gland. Remember, endo inside, exo outside. So what about when we're diaphoretic and sweating? Body is completely hot in a state where it feels it needs to be cooled down. Okay. Exocrine glands, thank you very much. That's how we get that sweat out that sebaceous oils, along with sweat, electrolytes, helps us cool down our external uh, or the integumentary system, but cools down body temperature for us, okay? How do we control the release of hormones? Negative feedback loops. Think about if you're, let me see if I got an example of this one here. Negative feedback, negative feedback. Let's say you come inside from the 110-degree heat in sunny South Florida. You're sweating, you're diaphoretic, or you're not cool, you're not calm, you're not cool yet. What do? Your body tells you, I sense that I'm hot. Again, hypothalamus temperature area. And it's kind of equivalent to you walking in the house and putting on the AC. You want to cool it down. You're going to click that AC down, turn it on. It's going to get cold. Once you reach a comfortable temperature, the thermostat shuts off. That's how our hormone system should work, or the endocrine system. We don't need it to continually run, 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 run. We need it to turn off now and again and let the blood level reach the appropriate therapeutic level. Okay, that's probably one of the easiest ways to think of it as, okay? You got some, again, here's another depiction of some of the major endocrine glands. Again, picture, I wish it would have had the thalamus in here, but it doesn't. It's kind of like um, the forgotten endocrine system here. Now, why does this all matter? Why are we even diving into the endocrine program? Well, again, chemical messaging works along with the nervous system as well. Okay. People all the time, when you go get lab work drawn to see how well when you get a thyroid panel drawn to see, hey, are you sleepy, fatigued, and gaining weight? Why? What's going on with you? Doctor orders some labs, and he or she's going to order a thyroid panel, among other panels, but they're going to start with the thyroid panel, and they want to see if your thyroid gland's working or not. Because if the thyroid gland's not working, okay, this is going to throw off your endocrine system balance. You may have some hypersecretion or some hyposecretion, which is why the patient normally presents fatigue if it's hypo. Okay. There's plenty more of information in your HESI book to kind of enlighten you on the endocrine system, but there's always areas of the endocrine system that you really need to uncover, and we're going to get to them. Okay. Here is kind of the back parathyroid hormone, where you can see there's 4 of those glands. Okay. And actually, the way you check a thyroid is from behind somebody and putting your hands kind of around their neck. We can demonstrate that in the lab for you. But the thyroid's located at the front of the neck. It has bilateral lobes. Parathyroids, again, near the thyroid, but they're kind of posterior towards the back. Here is, in this slide, kind of piece together how to remember some of the medical terminology, like adenoma, which is a tumor, or the angiogram, which is a radiograph of the adrenal glands. We've got some pituitary gland issues here, giantism. Okay, that's how a person reaches abnormal structure, that because of the too much growth hormone. Okay. Again, some of prefix and suffixes here, so you guys can better understand the medical terminology to go with it. When you're reading the chapters, it is definitely a great idea to check out some of the vocabulary words. Like, for example, hemoglobin A1C. That's where we want to know how well the patients maintain their glucose level over 90 days. Okay. Remember, I was talking about the thyroid panel. Prevention. How do you prevent endocrine disorders? A lot of this is lifestyle changes and diets. How do you prevent goiter or an overgrowth of the thyroid? Iodine. We need to make sure we have sufficient amount of iodine in our diet. The American diet, ladies and gentlemen, is consistent with enough iodine as far as in our foods or in the ocean, or what we see, excuse me, not the ocean, what we season our food with. I was talking about getting to sea salt here. But iodized salt is the major source for most people. So you want to make sure you can include that with not any new teaching, because remember, new teaching goes with the RN scope of practice, but kind of reinforcing isn't within the LPN scope of practice. So you can always reinforce teaching, okay? How else do you get endocrine system dysfunction? Remember, I talked about really the primary reason is oversecretion, undersecretion, okay? Hyposecretion is usually the result of destruction of the gland by either tissues or the inflammatory process, cancers. Now, secondary dysfunction occurs from factors outside the gland itself, like medicine, trauma, hormone therapy, or other factors, okay? And this dysfunction could be permanent or temporary. So you want to keep that in mind. Let's see here. Other tests to understand, the glucose tolerance test. That's basically where you're given a set amount of glucose to evaluate the pancreas's response by insulin secretion and the ability to metabolize that glucose. And that's normally done over the course of 2 hours. There's different diagnostic tests too to determine how well your endocrine system is working. Let's see if I have it included in here. Here's what I was talking about. This is how you palpate your thyroid gland. And this is an example of goiter here. Excuse me, goiter. Okay, with the enlarged thyroid gland, and then you have the exophthalmos that's happening here with the protrusion of the eyeballs. Okay, this is hypersecretion, which is hyperthyroidism. I would suggest to make a Venn diagram when you're learning about hypothyroidism versus hyperthyroidism, so you can compare and contrast and understand the differences between the two. And your HESI book also has some excellent resources as well. I'll get into diabetes more just a second here. So we talk about A1C, we talk about thyroid panels, but there's other tests too. There's even urine tests as well. Okay, like we can check, we can do a fluid deprivation test to determine or detect the diabetes insipidus. So picture this: patient's NPO. You're going to collect hourly urine, specific gravity, osmolarity are measured along with the body weight and vital signs. You can even give vasopressin sub-Q. Hourly measurements are continued for several hours. What do you do for that? Well, you talk to the patient. You provide urine collection containers and remind the patient to void if they can, or you will assist them. Okay. Again, you can also do a fasting glucose blood test. Again, that should be fasting for at least 8 hours, and that should be, according to your book, 70 to 110. Okay. Postprandial blood glucose. So after somebody eats, you take the blood sample 2 hours after a meal. Okay. And you want to see, and you can see the values here on the tables in your book as well. But there's quite a few that you can test: cortisol levels, calcitonin, TSH, T3, T4, FSH. It all depends on what is happening with your patient, how you and your physician or provider are going to medically manage them. Some of your nursing diagnosis here, well, you want to make sure that you are making sure that you're coming up with a plan of care for your patients, okay? You can ask some focus assessment style questions like weight loss or weight gain, energy levels, cramping, numbness, tingling, diarrhea, constipation, so any GI disturbances, feet and ankle swelling, voice changes, believe it or not, thirsty, right? Think about the signs and symptoms of diabetes, okay? Sleep patterns. Okay, even the people that are at high risk for sleep disturbances are people who work in healthcare workers who work the graveyard shift, the overnight shift. But back to the slide here. You got diabetes insipidus. Okay, I like to remember this by SIP and P. That's an insufficient amount of ADH, okay, or an insufficient response. Polyuria, polydipsia. Again, polydipsia is you're really super thirsty. Again, you're sipping, sipping, sipping all the time. Polyuria, you're peeing all the time. Sip and pee. Diabetes insipidus, sip and pee. Now you got diabetes mellitus, type 1 or type 2, okay? I think we're all pretty familiar with that, but this is where you have an insufficient or an improper use of insulin, okay? That's where your patient experiences hyperglycemia or glucosuria, where they got sugar, blood sugar, glucose in the urine. Patients can be medically managed different ways. Insulin injections, oral diabetic agents, metformin. There's insulin pens, insulin pumps, lifestyle changes, carb counting for children. Okay, especially when it's children, you want to carb count because they're children, right? Anyway, more about P's. This is diabetes insipidus continued here. I'll let you guys read through that. I want to get to acromegaly. Okay, these photos here, if you notice, you can see where they have an elongated chin. Fingers are quite large. Facial features are really predominant. Okay, and that's the hypersecretion of growth hormone after maturity. How do you know when when someone is done growing in their adolescence? Well, the epiphyseal plate of bones harden. They're not soft anymore, which signifies that growth has ceased. Okay. You can see the features here. Acromegaly, cretinism. Never say that right. This is a congenital deficiency of thyroid secretion. Okay. They have arrested physical development. This person is actually 33 years old. Yep. So this is where they basically stop growing, where acromegaly is the opposite. Growth hormone deficiency, again, it could be, this is dwarfism. Okay, you have an example here. They're both 3 years old. This is a comparison here of giantism and dwarfism. And your book also gets into it too. Hang on, let's get back over here to my page here. Probably got a little more than you need on this one, but please use this to study over the next few chapters regarding endocrine system. So giantism, again, overgrowth of the growth hormone, hypersecretion of the growth hormone, and then dwarfism. So you guys can see a visual representation of that. How do they fix it? How do you fix it? What's the interventions? Well, medications, lowering blood sugar agents, so maybe diabetic medications. How about surgery? Yes, it's an option. Wait till you see the next picture. Okay. Hypopituitarism is normally caused by pituitary tumor. Okay, you can have radiation surgery. But what does that all mean? What are the ramifications? No? Medication management, and of course, post-op management as well. Here's a representation how they do a hypothectomy. Okay, this is where they're removing part of the pituitary gland. Okay, to excise the tumor, to slow the growth, and we want to prevent any malignancy. We don't want the cancer to spread, so this is what they do. Yep, right through the nares there. Look, that's terrible. Visual representation of a very old style insulin pump. Now you can see some of the newer styles go on the back of people's arms and their Bluetooth. Again, so we put a tiny sensor into the integumentary system to monitor those capillaries to get a quick glance at blood sugar levels, okay? Cretinism, again, that's arrested physical and mental development. They have a small stature. And again, giantism is larger. Acromegaly is abnormal enlargement of the extremities, and you'll see facial features as well. Okay, all right, guys, kind of a short and sweet, but please enjoy the PowerPoint to supplement your readings. And I hope you enjoyed it.